It's the TBF Health Talk with VinvaE, and once again, TBF means the Teresa Bridget Foundation, which is a non-profit organization aimed at empowering, raising awareness for the elderly ones to live a better, healthier, and happier life. So today, it's my first health topic, and I'm going to be talking about hypotension. Right. Hypotension means low blood pressure, and for us to understand the concept of hypotension, we need to know the meaning of blood pressure. Blood pressure is the force of blood hitting against the walls of the arteries as the heart pumps out blood. So what's the arteries? What are arteries? Arteries, they carry oxygenated blood from the heart to other parts of the body, while the veins take deoxygenated blood from other parts of the body to the heart, with the exemption of the pulmonary veins and pulmonary arteries. The pulmonary arteries takes deoxygenated blood from the heart to the lungs, while the pulmonary veins carries oxygenated blood from other parts of the body to the heart. Oxygenated blood means oxygen rich blood, while deoxygenated blood means oxygen poor blood. So that's that for the arteries and veins. So now, when we know the meaning of blood pressure now, so now what is low blood pressure? You see? So look, the normal blood pressure of a human is 120/80 milliliter of mercury. That's the measurement. So if your blood pressure is 90/60 milliliter of mercury below, that person is said to have low blood pressure, and immediate treatment should be taken. You should see the nearest your doctor, your pharmacy, or a nurse. So that's that. I'm going to be talking. I've already talked about the meaning of hypotension, that's low blood pressure. So I'm going to be talking about the signs and symptoms, risk factors, the causes, the types, prevention, diagnosis, and treatment. So some signs and symptoms of hypotension are generally feeling sick, weakness, dizziness, temporary loss of vision, blurred vision, fatigue, rapid heartbeat, rapid pulse, severe back pain, chest pain, depression, painful urination, so severe allergic reaction. So these are some of the signs and symptoms of hypotension. Talking about the risk factors of hypotension, a risk factor is any characteristic of an individual that makes the person more prone to having a disease, an infection, a sickness, an illness. So anyone can have hypotension, anyone at all, but some people are at more risk of having this hypotension. So one risk factors of hypotension is age. Some type of hypotension affects the older ones, some affects the younger ones. So age is one risk factor of hypotension. Another one is medication. Some people on certain medication are at risk. They are more prone to having hypertension than an individual not on any medication at all. Then the third one I'm going to be talking about is some certain health condition, like the Parkinson's disease. Most people with these health conditions, I just named Parkinson's disease, but there are so many nervous system health conditions. Those people, they are at more risk of having hypotension. So I just listed age, medication, and health condition as 3 risk factors of hypotension. So the causes of hypotension are not always clear. They always link to one illness or one condition. So like bulimia, anorexia, pregnancy, Hypertension during pregnancy, should I say it's normal, because it usually goes away after childbirth. Hypertension that occurs during pregnancy, severe allergic conditions, some heart disease. But hypertension is usually linked to other sicknesses, other illnesses. So that's why it's really hard to detect. It's really hard for an individual to know he or she has hypertension, because when the signs come, they start treating for other things. They don't treat for it, and that's why hypertension is a silent killer. So you see some people sleep and they die. They die from their sleep. Some people snore. You see, they stand. You see, they say they have something like headache or something. Next thing they die, or just little complaint, and you see the next thing is death, because they, should I say, ignore. Let me say they ignore these signs. Not that they ignore, they actually don't treat the hypertension. They tend to treat other things instead of this hypertension. That's why hypertension is one of the, should I say, top 10 silent killers. So these are the few causes of hypertension. So I'm going to be talking about the types of hypertension now. One is the orthostatic or postural hypertension. This is the drop in low blood pressure when you stand up suddenly from a sitting or a lying position. Then another one is the postprandial hypotension. It's the drop in low blood pressure immediately after eating, and it usually affects the older adults, while the third one is hypotension from faulty brain signals, and it's the drop of blood pressure after staying in a hot place for a long time. This usually affects the younger ones. Then the last but not the least, is hypotension from damaged brain cells, and it's a rare disorder, usually known as the shy dragon disorder. So that's that for the types of hypertension. So now I'm going to be talking about prevention. It's really easy to prevent hypertension. It's so easy. It can be prevented from maintaining simple lifestyle, like eating low meals frequently. We should exercise, and we should watch our body postures. We should not always, when we're seated or we're lying down, we shouldn't get up immediately. It leads to drop in blood pressure. So we should drink water. We shouldn't stay in a hot place for a long time. That's one cause of it. So it can be prevented by simple lifestyle measures. It's really very easy to prevent. So now the diagnosis. Diagnosis means, okay, I'll break it down, like finding out if you have hypertension. And hypertension can be diagnosed by your medical history, your family history, series of tests, and a physical examination. So when you see a doctor, and maybe you have these signs, and you see a doctor, they'll ask you your family history, your medical history. If you've been having these signs for a long period of time, then they do a physical examination, then they run few tests on you to know if these signs are actually a result of hypertension, and if they are, then it goes to treatment. And the instrument for checking your blood pressure is called the sphygmomanometer. Yes, sphygmomanometer, that's what it's called. So when you get to your doctor's place or a pharmacy or a nurse, you ask them to check your blood pressure, and it's always advisable you have this device. You have one at home, so you can check your blood pressure regularly. If you don't know how to use it, you should ask your doctor to teach you. And there is a manual, and should I say electronic or automatic, I don't know. I have not me, my mom has the I'll call it automatic, and I'll be check my blood pressure here after this. So that is very easy to use. You don't even need anyone to teach you. You just wrap it around your hand and it reads. The upper one is the systolic blood pressure, while the lower one is the diastolic blood pressure. So if your blood pressure is 120/80, it's normal. If it's above, like really high, that means you have high blood pressure. I'm going to be talking about hypertension, that is high blood pressure, soon. Then if it's 90/60 millimeter of mercury below, you should please see a doctor. So I'm done with the diagnosis. My work isn't curative, it's all preventive medicine. So I don't have the power to treat. So if you want to treat yourself, you have to visit a doctor, get yourself checked, get yourself diagnosed. Then if it's actually hypertension, then you will be treated. So when going to see a doctor, you should prepare some questions to ask him or her, like why are you having these signs? Then you should list your medical history, your family history, and the things to do to stop these signs, to stop hypotension. So that is that. So I'm going to be doing this. Yeah, I'm going to be checking my blood pressure. It's called a sphygmomanometer. It's so easy to use. It's easier than the manual. I also have a manual there, but it's so technical. I don't advise you to use it if you're not a nurse or a health professional. So don't miss the reading. It goes like this. It's here. Is it here? That's it. Like this. Like this. Now, can you see? This is the this is the systolic blood pressure, and this is the diastolic blood pressure, and this is the pulse. So we'll start now. This is the on and off button. So once you click on start, the blood pressure starts counting. Yeah, it's going. I'll let you know when it's done. It's 94/70. My blood pressure is kind of low. Can you see? 94/70 millimeter of mercury. So my blood pressure is on the low side. So I need to do something about it before it turns 90/60 millimeter of mercury. I checked it last week. It was 100 and something. 60 something minutes of mercury. So this it, you should have one at home, so you can check once a month. So that's all for today. So I'll keep saying, and you always hear me saying, the first word is health. Prevention is better than cure. It's easier to prevent than to cure. So you should always check yourself. You should always watch out for your health. Please you should. And I'll see you next time. I'll be talking about a very interesting topic next time. So this month of September is according to WHO is the World Suicide Prevention Week. So I think I think I'm going to be talking about suicide prevention next time, but it's not yet confirmed. I might change the topic, but I think I will. So till then, please take care of yourself. Eat well, sleep well, drink water, exercise. Your stress, you shouldn't think much. Everything will be okay, alright? Everything you're going through will be okay, because stress no, I shouldn't be giving you spoilers, but you should always take care of yourself, please, 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 please. So till next time, bye. It's VinvaE from the TBF Health Talk with VinvaE. Please have a nice time, have a nice week ahead, have a nice month, have a nice